Welcome to the ABA Assessment Center in Raleigh, North Carolina. In this video, you'll get a preview of the Applied Examination's new component, the Objective Structured Clinical Examination, or OSCE. The Applied exam includes both an OSCE component and a standardized oral exam component. You'll take the OSCEs at the Assessment Center on the same day you take the standardized oral exam. The OSCEs will assess two domains that may be difficult to evaluate in written or oral exams. The first is communication and professionalism, and the second is technical skills related to patient care. In this video, you'll see the format of the OSCE, some of the different exam room setups, and snippets of 4 sample scenarios. The room setups will vary based on the skills being assessed. What you will see here are dramatizations of the exam. The room setup, equipment, and scenarios may be somewhat modified in the actual exam. The OSCE content outline, available on our website, lists the 9 specific skills on which you may be tested. They include technical skills such as interpretation of monitors and echocardiograms and application of ultrasonography, as well as skills related to communication and professionalism, such as reviewing treatment options with patients and dealing with ethical issues. While you're here, you'll participate in a 7-station circuit that will evaluate your proficiency in 7 of the 9 skills listed in the content outline. Each OSCE encounter will be 8 minutes long, and you'll have 4 minutes between stations to review your next scenario. The OSCE portion of the applied exam will take 84 minutes from start to finish. In some exam rooms, you'll interact with a standardized patient actor as part of the scenario. In others, you will interact directly with an examiner, but examiners will not be in most exam rooms. Instead, the sessions will be recorded for grading purposes. The following scenes don't show an entire OSCE session, but they will give you a sense of what you will experience and a demonstration of 4 of the skills that will be tested. Let's take a look at a scenario on peri-procedural complications. The candidate is in the process of evaluating a carpenter who is complaining of sensory loss in one hand 1 week after surgery.
I build furniture. I'm a carpenter. I do woodworking. I've always been able to use my hands.
Yeah, so this has got to be a little scary for you.
It's very scary because I want to get back to work. And at this point, I don't know that I can really use my tools.
Well, let's see if we can figure out what's going on. I'm going to ask you some questions about what you've been experiencing, and then I'll take a look at your arm. And we can talk about a plan on how to proceed.
Okay. What do you want to know?
How does your hand feel?
It's numb along the side.
Can you feel me touching you here?
I don't feel that.
How about here?
Yeah, that feels normal.
Have you ever had any nerve problems before?
Nope.
Okay. So can you give my hand a squeeze?
Sure.
For this skill, the candidate is asked to conduct a focused evaluation of a peri-procedural complication, in this case, a likely perioperative ulnar nerve injury. The candidate has to then formulate an action plan and discuss this plan with the patient.
I think one of the nerves in your hand has been injured.
Oh dear. How did that happen?
There may have been some pressure on the nerve while you were asleep, but sometimes we just don't know why it happens.
Oh. So now what?
Well, I'm pretty sure you have a nerve injury, but I'd like one of my neurology colleagues to evaluate you as well.
For the peri-procedural complication skill, you'll be assessed on your ability to perform an evaluation, develop and communicate a plan for further evaluation, and treatment of the complication. You will also discuss the potential cause and outcomes of this complication with the patient. Another skill that we will assess is addressing ethical issues when treating a patient. The next scenario involves a patient requiring general anesthesia who has a standing do not resuscitate order.
Mr. OSCE?
Yes.
Hi, my name is Dr. Barber. I'm your anesthesiologist.
Nice to meet you.
Nice to meet you too. I understand you have some questions for me?
Yes, I need this surgery today. I wanted to talk to you about my wishes not to be resuscitated if something goes wrong.
All right. I agree it's important we talk about this so I understand your goals. I understand you previously signed the DNR request?
Yeah.
need to talk with you about some of the things we normally do as a part of your anesthetic care. For example, anesthetics can lower blood pressure, and in most cases, it's reversible, but we sometimes use the same drugs to support blood pressure that we do with resuscitation.
Right.
So I would normally ask your permission to treat things that are reversible, even though it might seem like resuscitation in some situations.
Okay. Let me tell you what I'm thinking. I've got a lot of things wrong with me.
For this skill, the candidate is asked to frame and discuss appropriate plans to address common ethical dilemmas in clinical care settings. This scenario involves a patient with multiple comorbidities who wants to discuss his do not resuscitate order with the anesthesiologist who will be providing his care.
So we agree that if your heart were to stop under anesthesia, we would follow your wishes.
Yeah, I would just want nothing done in that case.
But here's the gray area. What if I used a medication that in almost everybody lowers blood pressure?
Right.
But I know that if I do a couple different maneuvers, I can bring your blood pressure up where it should be.
These maneuvers would be stuff like what you'd be giving me through IVs or...
Yeah, typically. It could be fluids or it could be medications.
But there's no physically reaching in, making my heart beat, stuff like that?
No, it wouldn't be chest compressions, only medications. If your heart were to stop, we would let you go.
Okay.
For this skill, you'll be assessed on your ability to elicit patient goals and treatment preferences, then formulate and discuss a plan based on those goals and preferences. In all scenarios involving patient communication, it is important to prompt and respond to questions and demonstrate understanding and concern for the patient's situation. Good patient care requires effective communication with other members of the healthcare team. In the next scenario, the anesthesiologist is having a conversation with a surgeon about postponing an elective sinus surgery in a patient with chronic obstructive pulmonary disease.
So she has quite a bit of wheezing and her oxygen requirement has gone up. I think she has either a new onset pneumonia or something else. I don't think it's the right time to press on with surgery.
You guys are killing me with the delays. Are you absolutely sure we can't move forward? Her pulmonologist told me 2 weeks ago that she's as good as she ever gets.
I understand, but her symptoms have gotten much worse since she's last seen her pulmonologist. Given her pulmonary condition and her worsened symptoms, I think if we were to take her to surgery now, she probably wouldn't do well, and we may not be able to extubate her at the end of the procedure.
Okay.
So my recommendation would be to send her back to her pulmonologist and get her optimized before we continue. This may delay surgery for the next few weeks.
Well, I'm booked up for the next couple of months and I don't know when I can fit her in. She's probably going to continue to develop these colds as long as she has problems with her sinuses. And she's in significant discomfort.
For this skill, the candidate is asked to demonstrate that she can effectively communicate with other healthcare team members in a professional manner. This scenario involves a patient who has experienced an exacerbation of her COPD and a surgeon who would like to proceed if possible.
If there is any way we can get her in here and get this taken care of for her.
I wouldn't recommend it unless you think this is an urgent procedure.
In her opinion, it might be an emergency. To be honest with you, it's not. It's probably not going to improve her acute pulmonary symptoms.
If this is an elective procedure, then I really don't think we should put her through the risk, given her symptoms.
What would you like to see numbers-wise, improvement-wise, before she goes into surgery?
For this skill, you'll be assessed on clearly articulating clinical considerations, formulating and communicating a recommended action plan for the patient, and demonstrating respect for the concerns of other healthcare professionals. Now, let's take a look at the candidate completing one of the technical skills scenarios. In this case, the candidate will interact with an examiner to identify relevant normal anatomy on a patient using a common ultrasound machine.
Hi, please come in. I'm Dr. Sorrell. I'll be your examiner in this station. Your first task is to obtain an image that will be used in the placement of a right internal jugular catheter. So please position your patient as you wish and use this ultrasound probe, which already has gel applied. and I will adjust the depth and the gain as you direct.
It's nice to meet you. Could you turn your head to the left? This jelly might be a little bit cold. I would place the transducer about 2 inches above the clavicle to identify the vein and artery.
When you've obtained the best image, I'll freeze it on the screen.
Could you increase the depth? There, that's good.
I've frozen the image. Keep the probe in place and use the stylus to indicate how you would position a needle to enter the internal jugular vein.
I would come in at about a 60-degree angle, a centimeter above the ultrasound probe.
Okay, I'll take the probe. Please come over to the ultrasound machine and use the stylus to show where the internal jugular vein is.
This is the internal jugular vein.
And where is the carotid artery on the image?
This is the carotid artery.
Okay, thank you. That completes your task. Let's move on to another task.
For this skill, you'll be assessed on your ability to use a common ultrasound machine to identify the normal anatomy relevant to placing a nerve block or an intravascular catheter. You may be required to complete several tasks at each of the technical skills scenario stations. We hope this information is helpful in giving you a sense of what you can expect during the OSCEs. You can find the content outline, exam blueprint, and other information on the Applied Exam page of our website. If you have any questions, please contact our Communication Center at 866-999-7501. Thank you for watching, and good luck.